Peptides and peptide therapy may sound like the stuff of futuristic medicine, but the truth is they're already here, quietly transforming how we treat everything from fatigue and pain to gut dysfunction and hormone imbalance. While conventional medicine continues to chase symptoms, a new generation of physicians are using these targeted molecules to actually restore health at the cellular level. Today's guest, Dr. Elena Zinkov, is at the forefront of that charge. As a trailblazer in women's health and longevity medicine, Dr. Zinkov is a naturopathic physician and entrepreneur and the founder of both Proactive Health ND and Perivive, a global women's health platform focused on hormone optimization and regenerative care. Her approach blends the best of both functional medicine with cutting-edge therapies to help women not only feel better, but to thrive at every stage of life. In today's episode, we're going to dive deep into peptide therapy, what it is, how it works, and why it's showing so much promise in modern medicine. Dr. Zinkov will break down when peptides are most effective, how to integrate them with naturopathic treatment plans, and what to know if you're considering them for pain, energy, gut health, and so much more. We'll also talk about the barriers, why more patients and providers aren't using peptides yet, the myths that still surround them, and how we can make this powerful approach more accessible to the people who need it the most. Whether you're a provider, a wellness enthusiast, or someone just curious about the future of medicine, this episode is packed with insights to help you better understand how and when to use peptides for optimal healing. Let's get to it. All right, Dr. Z, welcome to the show.
Hey, thanks so much for having me.
Like I told you, I'm gonna be Dr. Z, Dr. Zinkov, Elena, Dr. E. I want to keep you on your toes.
I respond to everything.
Thanks. I'm the same. But I'm different. They'll be like, "Oh, can I call you Greg or Dr. Jones?" I'm like, "You can call me Greg, but mainly Dr. Jones."
Yeah.
But it's just kind of just make sure you're comfortable. But first, I want to welcome you to the show. Very excited to have you here. I know we've been kind of like talking about this for maybe like a couple years now, and we finally made some time. I had to lasso you. Like, look, lose my number if you don't schedule it.
I think it goes both ways. We were both trying to make this work, and I think you were very busy. I mean, you're presenting and running a clinic, and I always see you doing amazing stuff at conferences, educating physicians like myself. So we're finally here. We made it happen.
I know. I think I saw you at A4M in December, and I think to me, it was hilarious. For you, it's probably annoying. You're like, "We got our podcast next week." I was like, "Huh?"
You're like, what? And especially when we catch you when you're like in the presenter mode, you literally have like your blinders on and you can't think about anything else. And when I said we have a podcast next week, you're like, what podcast? I'm presenting. I don't know what's happening next week.
I know, exactly. Yeah. This is why I should never control my own schedule in my no shape or form. But again, I'm super excited that you're here. And today we're going to talk about peptides. And I think that by now most people know about peptides. It's no longer kind of this, in the corner, what is a peptide kind of thing. But I also feel that it's a path still less traveled. And before we, I really want to kind of get into your journey here because again, peptides aren't taught in conventional medical school, naturopathic medical school, any type of school when it comes to peptide therapy. We know what they are, but how your journey from getting out of naturopathic medical school into this longevity peptide space, how did that happen?
Yeah, we certainly didn't get that education in naturopathic medical school. And the longer you practice and the more complex cases that you see in your practice, usually you're not the first doctor that patients are seeing, you realize that you need to really diversify your toolbox in order to achieve certain results. And after working on the foundational pieces, after working on gut health and removing environmental toxins and working on balancing hormones, after doing everything that we know how to do very well in naturopathic medicine and integrative medicine, once you start hitting those roadblocks, you start asking yourself, well, what's next? What's next? And this is when I started really looking into longevity medicine. I started looking into cellular medicine and really dove deep into peptide therapies and how we can improve things on a cellular level to help patients get the results that they're looking for. And I also have a personal experience with peptides as well.
You said you have a personal story when it comes to peptide therapy. Do you care or do you mind sharing that with us?
Yeah, no worries at all. I'm a totally open book when it comes to those things. I think it's important to have both a personal experience and a professional experience. I developed postpartum, rheumatoid arthritis and Hashimoto's. And as you know, any autoimmune condition can be very painful, especially rheumatoid arthritis. I could barely open up my hands in the middle of the night. I was in so much pain, and I didn't want to take medication just because of the side effects. And just being a naturopathic physician, I wanted to do what I would normally preach about, which is work on the foundations of health and balancing hormones and working on my gut health and, of course, stress management, especially being a new mom. And fast forward a few years, I was actually feeling quite a bit better, but I was still having quite a few flares. And that's when I started to dive into peptides, especially like thymosin alpha 1 and thymosin beta 4, and exploring the role of peptides in regulating inflammation. I also experienced a lot of hair loss as a woman in perimenopause, and especially with a double whammy of having autoimmune conditions, including Hashimoto's and RA. I used peptides, among other therapies, to help with hair loss as well. And, there I have a bunch of other stories. At any point in time, I'm probably using 3 peptides at a time, everything from cognitive health, like I love dihexa for perimenopausal women struggling with any sort of cognitive decline. I love growth hormone peptides, hair peptides, skin peptides. But personally, I saw a lot of improvement in my own health, especially when it comes to regulating inflammation.
Awesome, awesome. And it's good to have your own story with it. I think is good because one, I think when you've used peptides and you've seen them work for yourself or your family members, it's motivating. And then also, I think it allows us to connect to the benefit of it and then be able to relate that to patients. Because again, most of the things that we've been through, I mean, hell, doctors, man, we get sick too. We have health issues too. And a lot of times, again, one of the things that drives us into it, And look, man, as you know, going to naturopathic medical school, man, everyone starts off with 25 different chronic conditions. And it's almost one of those things. It's like, you hear something in class and it's like, oh, I think I have that. I'm like, I don't know about all that, but seems a lot.
There's a lot of self-diagnosing that happens in medical school. It's a blessing. It's like a double-edged sword, though.
No, it is. It really is. And I was always hey, everyone, calm down. Everyone calm down. I'm pretty sure you don't have Klebsiella. I'm pretty sure you don't have Klebsiella. I'm very sure of this. I'm going to just go out on a limb and say that you ain't got that. And it's just part of the gig, man. We learn and it's a good thing now. So,
I do have to say, though, I sometimes, when I talk about health as an investment and health as your greatest asset, like I remember when I was in my 20s and trying to figure out what I wanted to do with my life, I had my own condition, sort of how what you were saying is like we go into medical school and we have a bunch of issues that we're trying to resolve ourselves. And in order for me to get my health back on track, I had to go through medical school. I had to understand how my body works because conventional medical system was failing me. And my mom was a medical doctor. My mom was an MD. She was a family medicine practitioner. And she told me, look, we don't have answers really for women. We've got our antidepressants, we've got our blood pressure medications, we've got statins. We don't really have answers for people in terms of how we manage metabolic disease and prevent it in the first place. And so I was like, well, awesome. If conventional medical system is not going to help me figure out hormones, I'm going to go to medical school and I'm going to go figure it out.
That's good. I'm glad you did. Now, most people at this point have heard of peptides, right? I think at this point, since basically 2020, started with that, people looking for new things to do. And, so the familiarity is there. But how do peptides actually work in the body? And to tack on to that, why do we tend to see less side effects compared to traditional medications or even some supplements?
Yeah. So most people have some experience with peptides on a daily basis, like collagen peptides, as an example. And peptides are simply chains of amino acids, and they're very precise in the tissues and the systems that they target in the body. So we have different peptides with different functions. And some target brain health, others target cardiovascular health, metabolic health. There are different peptides for different systems. And one of the reasons why they don't have as many side effects is many of these peptides our bodies actually produce on their own. So I would say similar to something like bioidentical hormones, as an example, where progesterone bioidentical or estradiol bioidentical, our body sees it as its own, right? And unless you get the dose wrong, you put someone on the preparation that doesn't work with them or it messes with their detox pathways, normally people actually feel better, not worse, with these treatments. Whereas with conventional medications, it doesn't get to the root cause of the problem. Most of the time, we see suppression of symptoms. Whereas peptides, they actually improve cellular efficiency, function, glandular. They can restore glandular efficiency as well as organ health as well.
Yeah. That's good. And I think the other key piece as well, and you alluded to it, is that because peptides they're just amino acid sequences, right? And so that allows them
Yes.
to, number one, it's like, okay, we're not introducing anything foreign into the body, but they're also very specific in the receptors they can bind to. It's a very much key lock thing. And so
Right.
so again, with something like as great as magnesium, if you take too much magnesium, so hey, let's say I'm taking magnesium for a headache.
Right.
And I take a little bit too much magnesium in a different form, it is going to have the, like say receptors in the gut, and now you may have diarrhea. Where with peptides, we tend not to see that. And then I think the other thing that with medications, just from our perspective, is like a lot of times sometimes it's medication, sometimes it's the metabolite of the medication. Whereas peptides, it tends to be like
Exactly.
when they bind, they do their thing, and they come off that receptor, and they just disperse into their constituent amino acids, and your body may use them, or you might just pee them out. And so, and not saying you can't take too much of a peptide. There's definitely
right.
you can do that, but the chances of you being like, oh man, doc told me to do 5 units, the hell with that, I'm gonna do 50. That would be kind of crazy, right? And so,
Yes.
And that's kind of a good thing as well. So I like the fact that, like you said, there's a lot of different functions or features of peptides that makes it very safe for people to do. But at the end of the day, like, people are using peptides, they know about it, but it's not like super duper widespread, right? It's not like something like vitamin D, where everybody's taking vitamin D, right? There are some barriers to patients accessing peptide therapy. And in your opinion, what are some of the biggest ones?
I think lack of education is one of the biggest barriers, especially lack of education or awareness from a patient perspective, as well as education from a provider perspective. One of the things that I realized, especially the longer I'm in medicine, is how many healthcare providers are just not open-minded or as open to new therapies and something that's more progressive or available. And it's people like you and I who are talking more about it. It's the colleagues in our space who are trying to share this information with the general population to make this knowledge more available. And I think one of the biggest barriers is education. And the other thing is also some of the misconceptions that we have around peptides that are preventing more healthcare providers being open to using them.
Okay. So what are some of those misconceptions?
Yeah, I think one of the biggest ones is safety of peptides. And that goes back to people think that peptides have not been around for a long time, that somehow this is a new type of medicine. But again, just like with hormones, our body naturally produces these peptides, and they've been more researched than some of the medications that we have access to. And with fewer side effects. From a safety standpoint, we have solid research. We also have a much robust safety profile on peptides. Back to what we were talking about earlier. There's also this misconception that peptides are somehow steroid hormones, and that if you take them, something crazy is going to happen in your body, which is not true. So I think the biggest thing is safety. And the other thing is FDA approved. Everyone is looking for the FDA approved label. And if it's not FDA approved, which there are many peptides that are FDA approved, but you're getting into this regulatory phase where it may seem like it's the wild, wild west when it's actually not. And just because something is FDA approved or not FDA approved does not mean that it's good or bad medicine.
I think what kind of hurts it is there's a business component to it where a lot of times if you want to do a human study on something, somebody's got to pay for it. And in many ways, a
Right.
lot of the people who can profit off of it, unfortunately, it's like, well, if there is no investment, like take a peptide like BBC 157, right? Great peptide. I'm pretty sure we're going to talk about it later. Amazing peptide for healing, gut health, all these great things here. And it's just like, well, you start looking for a lot of like human trials in it. There's a lot of anecdotal in it. Sorry, there's a lot of anecdotal information. It's like, you can see like case studies, individual
Mm-hmm.
case studies, you can see
Right.
that, but you don't see like this large volume of information. Like if you take something like trazodone, you're going to see tons of papers. Where with like a peptide, you may not see that because again, there's not a lot of financial motivation. It's kind of like where you won't see a ton of studies on like ashwagandha. You'll see a few, but nothing too crazy because again, it's a supplement and obviously they're going to invest where the money is, right? And more novel drugs and all that. And so,
Totally.
we go off a lot of our clinical experience, a lot of the information we've seen, and then like the studies that are available. So I think the safety part of it can be, like I say, can be a barrier because people are like, and we're definitely going to talk about this one. It's just like, there's like I feel like, especially with some of the other podcasts that are out there in the longevity space, it's like, oh, this peptide can cause cancer. And I'm like, where'd you get that from? And you're just like,
Totally. Yeah.
where and why did you get that from? And that we're going to maybe broach into that a little bit later. I think another
Yeah.
thing is, and obviously it's not like I'm seeing a bunch of pro athletes and stuff like that. Unfortunately, most of them are actually kind of banned for the athlete, so with WADA and USADA and all that. So that kind of, I think that's another barrier too, which is crazy
Yeah.
because they're not necessarily performance enhancing, you know?
They're not. And I think sometimes people don't understand that in order for what we see professional athletes do, if I inject those peptides, I'm still not going to be like some of those professional athletes. Like there's so much more that goes into being a
Yeah.
professional athlete, as you know. And they really, going back to what we're talking about, what peptides really do, they are simply improving. They're either making better, right, what's already working well, or they're improving the things that are not working well. But you're not getting this like exponential boost in like your performance out of nowhere just by using one or two peptides.
For me, it's the healing. And I always feel like something that can help you recover faster, recover from an injury faster. Is that an unfair advantage? I don't know. That's a philosophical question, right? For the professional sport in the college sports leagues, right? But at the same time, if you make it accessible for everyone, like, hey, you should want your athletes back on the field faster or back on the court faster. But
Yeah.
that's a whole other debate right there. Getting into
Yeah.
the more controversial topics there. So you mentioned something earlier, and I want to make sure we dive into a little deeper here, is the barrier for practitioners. And this alludes to the very first question is like, there's not a peptide course in medical school. There's no board
No.
certification. There's a residency rather in peptides here. So besides that piece, and we can kind of dive into that more, what are those barriers or what makes prescribing peptides difficult for most practitioners?
Yeah. Well, one, it's not mainstream. So it's not something that's generally available in a conventional pharmacy. And that's also not just something that providers struggle with, but also patients, because one of the first questions is it insurance covered? And I know a lot of healthcare providers are burnt out from taking insurance and for many good reasons. And I know a lot of patients are getting frustrated with insurance companies because premiums are on the rise, but they're not getting any additional perks with their insurance. In fact, they're getting less coverage, so higher premiums, less coverage. No one is winning in this situation. Patients, healthcare providers. So one of the barriers is in terms of even healthcare providers having access to peptides or being able to use peptides is knowing which pharmacies to use, because one of the things I even educate my patients about and some healthcare providers who are entering into this space is you have to know who you're working with. And in order for us to make sure that we're prescribing peptides in a very safe way, we have to work with reputable pharmacies that are meeting the highest standards. And as you and I know this, but there's only a few pharmacies that really pass the test in terms of the quality of peptides that we're looking for, especially when we're looking into nasal sprays, injectables, things that are going to be readily available in the bloodstream and potentially can cross the blood-brain barrier, right? We want to be really careful with that. When it comes to oral peptides, especially some like capsule form like BPC 157, those are a lot more readily available. And still, right, I would say making sure that you know the source and having great quality assurance becomes really important. But knowing who is sourcing peptides, how they're getting their peptides, and who to go to for peptides is really important. And it's unfortunately not available in conventional pharmacies.
So there's this, I'm gonna say, battle, something we have discussions with a lot of times with patients and sometimes practitioners, and is research grade online peptides. And then you mentioned just like the
Don't get me
bane of my,
started.
we starting because, I think,
You
yo,
went
man,
there.
I've been there, and I'm tired of yelling. I'm tired of yelling at the sky with my fist, like an old
Yeah.
man yelling at the sky, and I need some help. So, so when a patient comes in and you're having a discussion, they're like, or sometimes, a lot of times is when they come see, it's like, oh, I've been taking peptide A, B, C, and D, and you're like, oh, okay, what doctor prescribed, what compound pharmacy, and like, oh, I got it from, company X online. How are you responding to that?
My first reaction is I wouldn't recommend it. So, as a healthcare provider with my license on the line, anything that I say or recommend, I would have to educate the patients. And I get this all the time where my patients come to me and they're like, well, the compounded pharmacy is so expensive. Can't I just have access to these research peptides online that are just a fraction of the cost? And I tell them, I'm sorry, but I cannot stand behind that. It is you. One, I can't agree to that. If you decide to treat yourself as a guinea pig and decide to use research peptides, that's going to be a personal decision, but that is not something that I will support. Um, and the goal is to really educate the patient and the public of why you don't want to be using research peptides that are not held to the same standard as some of these compounding pharmacies where the FDA is checking on them once a quarter to make sure that they're following the guidelines, right? So I and I've had experience where patients they've used some of the research peptides, and this is sort of one of the misconceptions too is people will come to you and they say, well, I tried this peptide and it doesn't work. And it's like, well, which peptide did you try? Oh, I got it from this website. Well, what dose did you try? And it's not even the standard dose, or it's not even the standard formula or form in which you would prescribe the peptides. So there's a lot of things that can go wrong in that scenario. And I think it's kind of scary to be able to just purchase something online that you're injecting into the bloodstream. Like that's not coming from necessarily a sterile compound facility, right? So number one, I would educate. And number two, I would try to reason with why we want to use an accredited compounding pharmacy that is not using peptides for research purposes. And if cost becomes an issue, I'm a very conservative prescriber, which means that I don't want to put people on a certain peptide medication just because they read somewhere that it's beneficial or they heard so and so's on certain peptide and that they want to try it. I want to make sure that it's necessary for someone to be on that peptide. I'm not just out here putting people on 10 different peptides. I want to make sure that we do the right thing in the therapeutic order, which there's a reason why we have the therapeutic order. I think it's very relevant and sometimes we forget about the therapeutic order, but we want to make sure that if peptides are costly because we're getting them from legitimate places and sources, well, let's talk about it. Let's see what are the necessary peptides that we need to have on board so we're not trying to get something cheap online.
Oh, I agree. And also on the side of the bottle, it literally says for research purposes only, not for human use or human consumption. I'm just like, well, shit, you got me there. That's all I need to see. But, again, I don't judge people, man. I just try to help them see the light. And I'll just say, hey, man, when you're ready to stop injecting research chemicals in your body, you can come see me. I'm here. And I'll be also ready to lower your
Totally.
liver enzymes. But, it's just one of those things we just learn, and we just kind of, I'm here to fix this rash on the injection site. And honestly, and some of them is like, and so you got to know what's going on. And sometimes I'll look at a certain peptide and I'm like, oh, what are people paying for it online? And sometimes because the vials they're providing for the research peptides are like the concentration, the dose can be lower. By the time someone gets 4 vials to make it through a month of the research peptide is literally about the same cost if you got it from us, depending on
That's true.
depending on the peptide.
Yeah. You're actually, that's a really good point. You're right.
Hey man, to each their own.
Mm-hmm.
So,
Yeah.
Obviously, like, we also, you say, I'm glad you mentioned therapeutic order and making sure it's the right peptide for the right person. Is there a patient profile that you see commonly that you feel benefits the most from peptide therapy?
Definitely. So a lot of my practice is I specialize mostly with women in women's health and women in perimenopause and beyond. And so I see a lot of benefits with peptides, especially from improving metabolic health when we're doing all the right things, but we're not seeing results. A lot of times for women, it's a frustration of I'm eating well, I'm working with nutritionists, I've got a personal trainer, I attend group classes, I'm hitting the 5 a.m. boot camps, trying to get to bed at 8 p.m. to get all the sleep, but I'm not losing weight, or I feel like I can't remember where I put the keys or where I left my cell phone. So I see peptides really helping in women, especially in midlife, to improve their metabolism, improve brain health, reduce risk of cardiovascular disease, improve libido, which also starts to tank with age. I also see peptides being highly effective in different folks, but especially in cases of just inflammation being out of control, and whether it's rheumatoid-like conditions or in general, like if they're prone to having more inflammation in their body, I see peptides can do a lot of good. And then, of course, I think we have an energy deficit where whether it's a metabolic issue, mitochondria issue, whatever it is, I think like all roads lead to the mitochondria, but we definitely have an energy deficit globally. And so peptides can really work on improving mitochondrial function and help us get that edge that we all need to make it through the day.
I like to think of peptides. Here we go. We got it. How far do we get? We got like 15, 20 minutes into this, and I'm just giving my first analogy. I'm very proud of myself. So I like to think of peptides as a tow truck, right? And a tow truck, and there's 2 types of tow trucks in this scenario. One that's going to get you out of the mud so you can get your car stuck so you can drive it now. Or also, look, this thing is not drivable. I need to get you home. Like, I can't just pull you out of the mud and drive you home. You need to keep taking this for a longer period of time. And so for me, certain peptides are going to be used to get you out of the mud. That's a cellular dysfunction, trying to modulate cellular function, improve a cellular function. For instance, like, okay, you sprain your ankle, you got some inflammation. I know you're not going to be inflamed forever, but I need to get this tow truck, get you out of the mud so you can drive. So I need to lower the inflammation, kind of lower the production of those inflammatory cytokines, get you going. Then there is look,
totally.
You are 67 years old. I'm pretty sure the melatonin is gone. No, sorry, the growth hormone is gone. The growth hormone is kind of gone, right? Or it's like, look, you may be producing it, your body's not releasing it. I may need you to do this peptide, maybe cycle it on and on a little longer, and I need to tow you. I need to get you home. I need to do this a little bit longer. So I'm kind of replacing something the body doesn't make as efficiently. And I even said melatonin because I think as obviously, get older, that the pineal gland kind of calcifies, and I may need to do a peptide that's going to help you with melatonin a little bit longer, because guess what? I can get you out of the mud, but like, if I stop giving it to you, you might not get any further. And so our job is to decide who's who and what scenario is what. There you go.
Yeah. I love that. That's a really great analogy.
Please
I might steal that from
free.
you.
No, don't.
I'll give you credit, though.
In case it falls flat. Like, who told you that shit? Dr. Jones, don't. It's a podcast. It was late in the day,
After we saw patients, right? We're trying to do this.
Yeah, I don't know what he's talking about. I thought I would try it. We won't do that again. So And again, it's good to know who can benefit from peptide therapy. Are there any patients that should not get peptide therapy?
Definitely. I think one example that really just comes to mind is patients who are prone to cancer or have a history of cancer. So I work with a lot of women, let's say post breast cancer, and we are safely incorporating other therapies, but they naturally have higher IGF-1 levels, which is what we use to it's a metabolite of growth hormone, something that we can use to see if someone is underproducing, overproducing growth hormone potentially. And so that is something that I'm very cautious about. Do I really want to be fueling these pathways, right? Do I want to contribute to excessive cell growth? And certainly it's very individual, but someone who's prone to cancer or someone who's prone to inflammation, we have to be careful with, because even something like a growth hormone peptide, someone who's in an inflamed state, it can sometimes make things worse. So we know that growth hormone, especially in autoimmune conditions, of course, it can help with collagen preservation and regeneration. It can protect the joint space. It can help with ligaments and tendons and all this other great stuff. But I know even from personal experience that if I'm, let's say, experiencing a flare for whatever reason, maybe I was traveling for a conference and stayed in a hotel that was a fancy hotel, but an old hotel. And then there was some mold exposure and that caused me to go into a flare, right? Things happen, but sometimes peptides, even like growth hormone peptide, which is technically stimulates your own growth hormone secretion. So it's not like we're taking synthetic growth hormone. It can kind of fuel that fire a bit and can make things worse. So I'm careful with patients who are prone to cancer, history of cancer, more immediate, not necessarily familial, and those who are in acute inflammatory states.
It's a great list. I think for us, again, thankfully, we haven't had many patients like, oh, well, hey, I came to you, we started, and now I have cancer. Thankfully, we don't really see that very often, which is,
Oh my gosh.
yeah, I know, which
Thank
is kind of a good
goodness.
thing. And, we're careful with it too. And this is kind of where it's like, well, I would say if it's a growth hormone peptide and it's like an active cancer, that's a no, you know, and it depends.
Oh,
Yeah. And,
absolutely
I
not.
don't
Yeah,
necessarily think that they would activate a cancer, and it's like, but again, if someone's like,
totally.
hey, I'm not in remission, I'm in the middle of, most likely they're in chemo and radiotherapy, something like that.
Yeah.
Um, I'm probably going to be more of like, but here's that double-edged sword, because something like BPC 157 can actually help detoxify some of the toxicity from the medication. Y- y- but then you run into
Absolutely.
this debate
Yeah.
sometimes we get is like, oh, I read that BPC causes angiogenesis, where the study shows that a lot of studies I've been reading show that angiogenesis that it creates is in the site of an injury. Nothing says that it just spontaneously
Mm,
causes angiogenesis. It's like, oh, look, I need to make some new blood vessels, right? And so I think there's a matter of caution with it, but I
right.
also think that there's a matter of like um, discretion. Not discretion. That's what I'm looking for here. I'm looking for the word where it's just like, hey, hmm, we're a little bit of discernment where it's like, hey, you know what? This may help you in a short period of time. We look at the risk, we look at the benefits here and make that decision. So I guess where I'm going with that is like we take it case by
Yeah.
case, but our job is to not make anything worse. So definitely on a pro-inflammatory state, like a hyper-inflammatory state, certain peptides, no. It's like, look, yeah, there's inflammation. I might go with a thymosin in those scenarios, things like that. Or I may say, hey, before we get into the peptides, look at some LDN, or maybe like your vitamin D is 12. Maybe start there.
Totally.
It's like, maybe start
Basics
there.
first. Yeah. Well, you bring up a really good point about who shouldn't be on peptides, the patient who hasn't done the work yet, right? So if someone comes to me, whether they want to lose weight, improve sleep, build muscle, reduce inflammation, improve their memory, we don't just hand them a slip
Oh,
for a
yeah.
bunch of peptides. We got to do the foundational piece. We got to take care of the gut, got to take care of the terrain. We have to improve the internal, external environment. We have to balance the basics, the hormones, right? And then I look at peptides like the cherry on top of the
Mhm.
sundae, right? Where we improve everything else. And then when we still either are not seeing the results, right? Like the tow truck analogy, like if we cannot get you out of that mud, we might need to recruit
I
either a
know.
bigger tow truck, maybe two tow trucks, right? Whatever that looks like, and keep you on something for an extended period of time to actually see results while we are actually digging deeper, doing additional testing to see what's going on to better understand the picture. But it's certainly not for someone who's not done the work. Like a lot of times women will ask me, like, I'm experiencing hair loss. What peptide should I use? And I'm like, well, assuming that you've already done everything else, assuming that you've had your ferritin, your iron checked, your vitamin D, your thyroid, your hormones, just basic things, right? Assuming that you've done all those things, that you've worked on improving your diet, that you've improved your stress, that you're not nutritionally deficient, that you're not just doing like hours of HIIT workouts during the week. Assuming that you've done all of those things, now let's
Yeah,
talk about
love it,
peptides.
love it. So now we're into the
Yeah.
fun, the heart of the episode. So I know, we haven't even
Oh,
got to the good stuff yet.
was it not? Was
Yeah, it was
everything else
good.
not
It's
important
all
that we
right.
talked about?
But now it's time to get into some of the, we can build upon the things that we talked about and to some of the cool stuff. So,
All right.
I always think about like when it comes to naturopathic medicine, there's certain common things people, for the most part, come see us for, right? And, if I had to do like a survey, family feud style, what do people go see naturopathic doctors for? Fatigue, bing, gut health, yup.
Right.
Um,
Yeah.
Hormones, yes, indeed. Yes, indeed. Chronic
Mm-hmm.
conditions, autoimmune. But
Mm-hmm.
again, we can go on and on and on. But the three that I'm going to kind of put you on the spot for are pain, fatigue, and gut health. Because again, I think that gets
Awesome.
people to the door. It's just like where they tend not to. Because a lot of times I say these are ones where someone's like, "Hey, I went to doctor clinic A, B, C, and D. They offered medication. I really don't want to do that. I'm here to see you." And so, where do
Right.
peptides fit in that sort of big three?
Yeah. With the pain component, and I really appreciate you asking this. With the pain component, I really see the thymosin peptides work very well. And our thymus gland, it's not the sexiest gland to talk about, but it's pretty important when it comes to immune regulation, inflammation regulation, and especially when it comes to pain management, and reducing inflammation. I think of thymosin alpha 1 as a really important immune regulator. And what we have found actually in research is that people who are prone to even autoimmune or more pro-inflammatory states, they actually have lower levels of thymosin alpha
Right.
1 in their system. So what's interesting is a lot of medications, including like methotrexate and a lot of these other rheumatic medications, they when they test people before and after the use of these medications plus steroids, their thymosin alpha 1 levels go up compared to people who are not on these medications. But of course, kind of going back and making the connection here that there are so many side effects to these rheumatic medications, from digestive upset to full on immune suppression. And this is where peptides present a really great opportunity and alternative treatment where patients start on thymosin alpha 1 and they see a pretty significant and dramatic improvement in their joint pain and inflammation. I do have to say that I am more careful with thymosin beta 4 when it comes to inflammation, because it can kind of go either way for some folks. For some people, it works really well, and for others, it can kind of fuel that fire a bit more. But I've seen very good results with thymosin alpha 1, also really great results for pain management and recovery with BPC 157. That is sort of a miracle, right? Peptide, it can work in so many different ways. And it's going back to what we were talking about earlier, peptides are very precise. They can go to the place of injury. And just like our body sends signal to, hey, go here, repair here, that's sort of how peptides work as well. So from a pain perspective, those are the peptides that I would use, the BPC and the thymosin
Okay.
peptides. From fatigue perspective, MOTS peptide, MOTS-c is fabulous. I mentioned earlier, all roads lead to mitochondria. And of course, we've got thousands of mitochondria per cell in our brain cells, in our heart cells, liver cells, muscle cells. And so we have to make sure that we're doing things that we can improve mitochondria health. So if someone is chronically fatigued and for whatever reason, whether it's acute stress, chronic stress, recovering from injury, a burnt out athlete or a corporate athlete, MOTS can be really beneficial The other one, of course, is anything that we can use to stimulate our own innate NAD production, and that's the 5-amino-1-MQ, which I think is very beneficial. And then the other one was gut health. Super important. I would say right up there with improving mitochondrial health, BPC 157, KPV. Those peptides are really important with gut repair and reducing inflammation, and our rock star peptide liraglutide, which I think is really important for sealing those leaky gut. I was going to say leaky guts. Leaky gut.
There's multiple, not in one person, but there's all over the world.
There's multiple. There's a lot of us.
Guts.
Sealing the leaky guts around the world. That's liraglutide for you.
And I'm glad you mentioned the 5-amino-1-MQ, where and I feel like sometimes I put these things in buckets because it's like, it's not really a peptide, but I ain't got a place to put it. We're just going to call it a peptide. Just because I think it's in that, and we can say it's in the cellular longevity medicine bucket, but sometimes it's just easier to say peptide. And I'll break it down to you before. Yeah, I'll break it down to you before I prescribe it, or I recommend it or talk about it with you. A better way to say that. Okay. Let's see. So we got.
Oh, can I say something real quick in terms of inflammation?
You're just kidding. Just kidding, please.
I'm out. Next. I'm like that patient, it's like you're 10 minutes past the time when the appointment's supposed to be done. And you're like, I got one more thing, doc.
As I'm getting up out of my chair. As I'm getting out of the room. Like, no, you don't. You ain't got nothing else. Just kidding.
I'm going to find you, Dr. Jones. I'm going to find you. So I was just real quick. So people don't think about this as a peptide, but glutathione. Glutathione is super important and is a peptide, right? Available technically over the counter, liposomal form. But it's also really great anti-inflammatory. And from a pain perspective, glutathione is very important. So I would just want to throw it in there that, it's not too expensive and is a great option.
I mean, it's close to one. You got with glutamine, cysteine. What's the other one? What's the last one? Is it?
Oh, gosh, you're putting me on the spot.
I'm on the spot too because I should have just spat that out. And now I'm just like glutamine, cysteine, and there's one more amino acid.
We need someone in the background.
Man, when I blow this thing up, we'll get that third person. But in the meanwhile, we're gonna do this. On is. Dun, 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 dun. Yep, glycine, cysteine, and glutamate.
That's right.
Yep. Glycine, cysteine, glutamate, right? So you got your three aminos there, but it's not, technically it is a, and let's do this here. This is good for me too. It is actually considered a tripeptide. So there you go. Organic.
Yes, it is a tripeptide, right? Thanks to those amino acids.
Small tripeptide.
Which is why NAC, right, N-acetylcysteine is a precursor for glutathione. So that's another way that you, just like 5-amino-1-MQ can boost your NAD levels naturally, so can supplementation with NAC, N-acetylcysteine, can help with your glutathione reserves.
Perfect. I want to put you on the spot for one more. You love it, right? It's
Wonderful.
like, this is, that's why I say the best part is spotlight time here. So,
life in the fast
so a lot
lane.
of times when people, they start trying to learn more about certain peptides for pain, they'll see thymosin beta-4, but they'll also see TB500 or TB4 frag. What is the difference, or is there a difference?
So the TB500, as I understand, it is a it's derived from thymosin beta-4. So just like let's say we're testing insulin and there's a C peptide, right? So we've heard about cagrilintide as for weight loss. It's that small snippet of the insulin molecule. So similar TB500, it is the synthetic version, I believe, of the fragment of thymosin beta-4. So if I were to choose which one I would use thymosin beta-4. Am I correct on that one, or am I way
it
off?
is
At least that's my
it's part
understanding.
of the sequence of TB4. And I believe it's the part of the sequence that directly does some of the anti-inflammatory kind of pieces for. But I think with like you're
Yeah.
right with TB4 because you're getting a little bit more broader spectrum kind of benefit from it. When it comes to that, I think
Yeah.
if you had to, I don't use the word choose, because we're doing more educational stuff here, the TB4. But again, it also depends on that relationship that the person has with their physician on what they have access to and all that. We hit some good ones, man. So you
Yeah.
got the MOTS-c, you got the 5 aminos, you got the BPC-157, lorazepatide, great for a Xylem agonist, healing leaky gut. You got the KPV
Mhm.
for inflammation. Energy is a tough one, man. As you know, energy is just tough because there's so many factors in energy because it's like, okay, well, you can be on the peptides in the world, but it's like, I only sleep 4 hours a night. Well, you're probably not going to have a lot of energy.
Right. Well, that's sort of where, for example, something with energy. I actually had this questions. I was doing a presentation in front of a group of women at a mastermind, and they were asking me, how do we improve our energy? And we spent 2 hours talking about how do you improve your energy, because it goes back to, well, how do you sleep? And then what's happening before bedtime? And if you're not producing enough growth hormone, as an example, then you potentially are not sleeping well and your HRV sucks and you're not getting enough deep sleep, right? Instead of 60 to 90 minutes, you might only be getting 20 minutes of deep sleep throughout the night. So then you're not recovering as well and your energy sucks. So if we were to if talking about just even energy, what are different ways that we can improve sleep in order to wake up and feel more refreshed?
Love it. Love it. You're almost home, Doc. You're almost
Yeah.
home. All right.
I'm good. I can
No,
talk
it's
about
so
this
amazing
all
here. So,
day.
the next one here, another like, I don't say on the spot here, but a question I definitely want to ask you is what are some of the biggest myths or misconceptions about peptide therapy that you encounter? You got the steroid one. You got,
Yeah.
I'll give you
So
one. You got the freebie. You got the peptides are not steroids one, or people consider them steroids. So we got that one. All right.
yes. Cancer is the other one. I think it's a really big thing. Is just you just hear a bunch of different peptides that, like, even growth hormone peptide. I had a patient a few years ago. His IGF-1 was pretty low, and he could have definitely benefited from like a growth hormone releasing peptide. And the thing that he told me was that, like, no thanks, I don't want to develop cancer. And that's one of the biggest misconceptions, is that somehow these peptides are going to be contributing and fueling proliferation. And this kind of goes back to what we talked about earlier, but it's one of the biggest misconceptions that certain peptides can cause cancer. The other thing is, again, a lot of these peptides, they've been around 1970s, 1990s. They've been around for a very long time and have been studied through extensively. So I would just encourage people to familiarize themselves with more of the research that's out there and the data, and have a qualified healthcare provider, not their neighbor, unless they're a qualified healthcare provider, not their mom or dad, unless they're a qualified healthcare provider, to talk to about these things and to filter through, because I frequently hear patients say, well, so and so tried this and they had horrible results, therefore I don't want to try it. It's like, you guys are different people, and you potentially may need the same peptide or you may need a different peptide, but you want to make sure that your friends are not your doctors.
I wish I could. No.
Unless and what I mean by that is, like, unless they're a qualified healthcare provider and can talk to you about these things
I
and
know,
help you
because
filter
you
through.
hear that, I'm like, hey, friends of mine that I'm your doctor, right? Done.
I was going to say, you're my friend. That's not what
Done.
I meant.
Done. It's so done. No,
I'm
no,
digging
no, no.
myself
It's
into a
okay.
hole
That's all
here.
good though. No, I can just always edit that piece out. But no, in general, I do appreciate that. And I do want to, before we kind of do some closeout here, I want to, this question I tend to ask all my guests here is because it's like we tend to learn so much, and I know I'm speaking for myself here, but I can pretty much, I don't want to say bet that you as well. Like, I look back at the doctor I was when I first graduated versus the doctor I am now, and hot damn, so different. Because experience, you
Yeah.
get comfortable, you get confident
Yeah.
and all that. And then I look back at some of the treatment plans from, oh boy, and we just learn. But, I feel like
Yeah.
you have to go through that. You have to go through the imperfections. You have to go through the mistakes. You have to go through I need to learn more about this, get more educated on this to become the doctors we are now. And so I never want to skip over my
Yeah.
stumbles. My stumbles made me, and just like hopefully, most people that are just like yourself being
Totally.
successful, your stumbles make you, right? Because you came out of med school knowing it all, then it's like, and that's
Then life
hubris as well,
happens.
coming out thinking you know it all. Now, I do want to ask you though, if you could go back in time and meet your you just got off the stage, they just gave you your little diploma that had nothing in it for a ceremony, and you walk off stage and you're just like, hey, you, it's future, it's future you. Yeah,
It's
no.
your
What
future
is the
self.
one thing you would tell yourself?
I would say you're never done. You're never done learning, and you have to keep an open mind because I think especially like naturopathic medical school, not many people know this unless you go to naturopathic medical school, but it prepares you so well. It prepares you so well to handle complex cases, to use critical thinking, to think through different problems. And you have such a diverse toolbox to help people in many different ways, but you're never done learning. And just when you think you figured it out, guess what? You didn't. And that it's okay. And that it's okay to be a forever student and to continue having an open mind and a curious mind because you're
I
never
like
done.
that. I like that. They're
Yeah. So buckle up
you better,
and enjoy.
because still be learning to this day. I'm like, I didn't know that to this day. And my patients educate me a lot too. Sometimes it'll be like, hey, I did A, B, C, and D. I thought you were going to respond this way. Oh my God, that's totally opposite. What am I missing? And then you get into the research and you're like, damn it, or you know what, I didn't think about this. Let's try something different. And I think that's how we keep growing. And I think medicine
Totally.
it'll humble you, man. It is very humbling. As soon as you think you got it figured out, it's like, oh, well, hell, you go to a conference and someone's on stage, you're like, yeah, I got some work to do, right? And I do appreciate that. There's always a challenge.
Totally.
All right, I think
Yeah.
I've tortured you enough of torture. So before you get out of here, where can people learn more about you, your work, and your clinic and your practice, and all the amazing things that you're doing?
Yes, I'm always active on Instagram, always asking and answering people's questions. So at Dr. Elena Zinkov on the IG platform. And then my clinic is Proactive Health ND, and my personal website, drelenazinkov.com. I have some free resources on there and some basic classes and information that may benefit
Awesome.
some people.
And I'm going to put all that in the show notes for everyone listening or watching. So all the information will be down there so you can contact Dr. Zinkov and learn more about her journey. She's a powerhouse, man. And I'm very proud that I'm proud that we're friends, man. And I'm very honored that you took the time to kind of hang out with us today and teach us a little bit more about peptides.
Thank you so much. It's been a pleasure.
All right, everybody. This is Dr. Greg Jones signing off of this episode of the Optimization Academy with Dr. Elena Zinkov. To learn more, get into the show notes. Follow Dr. Z. Subscribe to the channel. Keep learning. Never stop learning. Never stop searching for information, and never stop looking for the answer. And get your tow trucks right. Anyway, so this is it. Signing off. See you soon.